So we have periodontal ligament part 5. Okay. Hashtag forget series. So what is the sensory function of the periodontal ligaments? Sensory function. What? Periodontal ligament has got nerve supply. Through it, they have a proprioceptive mechanism, which senses even a grain of sand between the teeth. Provides an efficient proprioceptive mechanism. Okay. So what is the nutritive function of the periodontal ligaments? So when you talk about the nutritive function, what happens for nutritive? They have this. Periodontal ligament have blood supply. So they provide anabolites and remove catabolites from the ligament. Periodontal ligament. Yeah. Then we have cementum and the alveolar bone with more importance to the cementum because avascular cementum transmits blood vessels. So they provide anabolites from cells of ligaments. From some cells of ligaments. Yeah. So what is the periodontal ligament consists? The periodontal ligament is continuous with the gingival connective tissue above the alveolar crust. Yeah. So how are cementicles formed? Cementicles are formed how? Yeah, cementicles. So cementicles are formed from thrombosis of blood vessels, and we have the spicules of cementum and alveolar bone undergoing traumatic displacement, and we have this of the degeneration of epithelial cell crusts, cell rests, and Sharpie's fibers. Yeah. What is the function of apical group of fibers of periodontal? So apical group of fibers of periodontal ligament is what function? Prevent tooth tipping and resist forces of luxation. Yeah. Prevent tooth tipping and resist forces. What are the cellular components of the periodontal ligament? So we have this synthetic cells and resorptive cells of various various resorptive cells are various cellular components of the periodontal ligament, something like that. Various structural components of the various structures. So synthetic and resorptive cells of various structural components of periodontal. Where are the epithelial cell rests of molasses found in the periodontal ligament? So epithelial cell rests of molasses is found in the periodontal ligament close to the cementum. Yeah, what is the homeostatic function of the periodontal ligament? So periodontal ligament have synthetic cells and as well as resorptive cells, and they maintain the homeostatic state of the periodontal ligament by maintaining the composition and composition and amount of something in the periodontal ligaments. Composition of extracellular matrix. So synthetic resorptive cells of various structures, responsible for maintaining the homeostasis of periodontal ligament by regulating the composition and amount and composition of extracellular matrix of the extracellular matrix. Composition of the extracellular matrix. Okay. What is the periodicity of collagen fibers? Collagen fibers have transverse striations and have a periodicity of 64 nanometer. Characteristic periodicity 64 nanometer. Yeah. So what are macrophages? They are phagocytic cells found close to blood vessels, derived from monocytes of blood cells. Then what? Shape. Round or ovate shape with horseshoe or kidney shaped nucleus. Round or ovate shape with horseshoe or kidney shaped nucleus. We have macrophages. What is thixotrophic theory of root supports? Which states that periodontal ligaments have a rheologic behavior similar to thixotrophic gel. Yeah. So what is the progenitor cells found? The progenitor cells is found in the periodontal ligament with perivascular location. Perivascular location. So where do the apical group of fibers fiber bundles radiate from and to? We told apical group of fibers is actually responsible for preventing the laxation, resisting the external forces of laxation, tooth tipping. Yeah. So where do the apical group of fiber bundles radiate from and to in the periodontal? Where do from and to? They radiate from. So this apical group of fibers radiate from the apical region of the tooth to the surround. They radiate from apical region. They radiate from apical region of the tooth to the surrounding alveolar bone. So they radiate from apical region of the root. They radiate from apical region of the root to the surrounding alveolar bone. Apical region of the tooth to the surrounding alveolar bone. Yeah. What is the homeostatic function of the periodontal ligament? We told it. What? They have synthetic and resorptive cells of keratin structures in the periodontal ligament, which actually maintains the homeostatic nature of the periodontal ligament by maintaining the amount and composition of the extracellular matrix. Okay. So homeostatic. What is homeostatic? So periodontal ligament has synthetic cells and resorptive cells that help in remodeling the what connective tissue components of the periodontal ligament, cementum, and alveolar bone, which is essential for maintaining the functional integrity of the periodontium. Okay. So what is homeostatic nature? So they have synthetic cells and resorptive cells of various structural components of the periodontium, which help in remodeling the connective tissue components of the periodontal ligament, cementum, and alveolar bone, which is necessary for what? Maintaining the functional integrity of the, which is essential for maintaining the functional integrity of the periodontium. Okay. What is the function of So what is the function of interradicular group of fibers in the periodontal ligaments? Interradicular group of fibers in the periodontal ligaments. They help in resisting tooth tipping, luxation, and torquing. This is interradicular. The apical group of fibers is there. This is interradicular. Interradicular also we have tooth tipping, luxation, and also we have torquing. Okay. Interradicular group of fibers they help in resisting tooth tipping, luxation, and torquing. Interradicular group of fibers in the periodontal ligaments. So what is the abnormal occlusal forces? How does the abnormal occlusal forces affect the periodontal ligaments? Abnormal occlusal forces can damage the periodontal ligament, resulting in stretching of periodontal ligaments and expressed as widening of periodontal space, and it is expressed as widening of periodontal space. So abnormal occlusal forces result in the stretching. Stretching. Abnormal occlusal forces result in stretching of the periodontal ligament, expressed as widening of the periodontal space. Okay. What triggers progenitor cells to enter the cell cycle? What? Maybe like lack of cells. When the progenitor cells enter the cell cycle. So progenitor cells enter the cell cycle when triggered by a stimuli. What else? So what is the characteristic finding in the disease? Characteristic finding in a disease involving many teeth. Abnormal thickening of the periodontal ligaments. Okay, expressed in radiograph. Abnormal thickening of a periodontal ligament expressed in radiograph as uniform widening of periodontal ligament involving many teeth. So what is the characteristic finding in a disease involving many teeth? So we have the abnormal thickening of periodontal ligament is expressed in radiograph as widening of periodontal ligaments involving many teeth. Uniform widening of periodontal ligaments expressed in radiograph as uniform widening of periodontal ligament involving many teeth. What are interstitial tissues? Areas of loose connect. So what are interstitial? What are interstitial tissues? So in the areas of loose connective tissue found between and among the dense bundles of what are interstitial tissues? Areas of loose connective tissue found between and among the dense bundles of principal fibers in periodontal ligament are referred to as interstitial tissues. What are interstitial tissues? Areas of loose connective tissue found between and among found between and among principal fibers in periodontal ligament is called as interstitial tissues. Is referred as interstitial tissues. Is referred as interstitial tissues. So what is the sensory functions of periodontal ligament? So they have periodontal ligament nerve supply, which forms a proprioceptive mechanism, which even senses a grain of sand between the teeth. So what is the potential of epithelial cell rest of molasses? Epithelial cell rest of molasses have the potential to differentiate into cementoblast, osteoblast, fibroblast. So they have the potential epithelial cell rest like progenitor cells. Osteoblast, cementoblast, fibroblast. What is the odontal ligament? What is the odontal ligament? Odontal ligament is a fibrous connective tissue that connects the odontal ligament. What is odontal ligament? It's a fibrous connective tissue. Okay, that connects the tooth to the alveolar bone. Okay, alveolar bone. We say like bony socket. Yeah. So odontal ligament is a fibrous connective tissue that connects the tooth to the alveolar bone. What are transalveolar fibers? Transalveolar Sharpie's fibers that occasionally transalveolar fibers. Sharpie's fibers that occasionally pass through the bone of the Sharpie's fibers. Sharpie's fibers, okay, that occasionally pass through the bone of Sharpie's fibers that occasionally pass through the bone of alveolar process to continue as principal fibers of the adjacent periodontal ligament are referred to as transalveolar fibers. What are transalveolar fibers? Okay, the Sharpie's fibers that occasionally pass through the bone of alveolar process. Alveolar process to continue as principal fibers of the adjacent periodontal ligament is referred to as what? Transalveolar fibers. Sharpie's fibers under certain circumstances. Transalveolar fibers. Okay. What is the homeostatic function of the periodontal ligaments? So they have synthetic cells as well as what resorptive cells that help in maintaining the homeostatic state of the periodontal ligament by controlling or maintaining the managing the amount and composition of the extracellular matrix. That is homeostatic function. Yeah, synthetic cells responsible for maintaining the homeostasis of periodontal ligament by regulating. You regulate it, okay. What are accessory fibers in the periodontal ligament? Like other than principal fibers, you have accessory fibers. They are found associated with it, like that. A second group of fibers in the periodontal ligament that assist in function alongside the principal fibers. So what accessory fibers? They're second group of fibers. Okay, found as which help in function. That assist in function alongside the period. That assists in function alongside the periodontal principal fibers. Okay. So where do the apical group of fibers radiate to and from? So they radiate from the apex of root. Okay, apical part of root to the alveolar bone, to the surrounding apical region of the root to the surrounding alveolar bone. So what is the composition of fibers in the periodontal ligaments? Like collagen will be there. Collagen. So more than 90% of the and this oxytolin and iluvalin are like immature elastic fibers. That supporting the blood supply, regulating the blood flow. Yeah. So more than 90% of the connective tissue fibers in the more than 90% of the connective tissue fibers in the periodontal ligament are mainly collagen, with oxytolin and iluvalin are also present. Oxytolin and iluvalin are also present. Yeah. So what is the function of apical? What is the function of apical group of fibers in the periodontal ligaments? prevent tooth tipping and resist forceps luxation. Yeah. So what is the periodontal ligament? When you talk about periodontal ligament, periodontal ligament is a soft fibrous connective tissue, which is you can see to be cellular and vascular, that connect the tooth to the bony socket. And we can say that it is interposed between what? It is the periodontal space. Yeah. Interposed between the inner wall of alveolar socket and teeth. Between the roots of teeth and the inner wall of alveolar socket. Yeah. Roots of teeth, inner wall of alveolar socket. So what is the homeostatic function of the periodontal ligaments? Yeah, like resorptive cells, synthetic cells, regulate composition and amount. So we have this resorptive cells and the synthetic cells that are helping remodeling of the connective tissue components of the periodontal ligament, cemendum, and alveolar bone, which is necessary for maintain the structural integrity of the periodontium. Okay, help in the remodeling of the structural components, mainly the functional integrity of the periodontium. So they help in. So what is the homeostatic function of periodontal ligament? We need to talk about the remodeling of the connective tissue components of the periodontal ligament, cemendum, and alveolar bone, and also functional integrity of the what is the role? Mainly the functional integrity of the periodontium. What is the function of interradicular group of fibers in the periodontal ligament? So it is interradicular group of fibers. Role is luxation, prevent tooth tipping, and also torquing. Yeah. So what is the radiographic incidence of scleroderma in so what is the radiographic evidence of scleroderma in periodontal ligament? What is the scleroderma in periodontal ligament? What is the radiographic evidence? Uniform widening of the periodontal ligament involving many teeth is the characteristic finding of scleroderma. Okay, uniform. So in scleroderma, so uniform widening of the periodontal ligament involving many teeth is the characteristic radiographic evidence of scleroderma in periodontal ligament. So we have uniform widening of periodontal ligament involving many teeth, scleroderma. Radiographic evidence. So what triggers progenitor cells? Stimuli. So how does occlusal, abnormal occlusal forces affect the periodontal ligament? They cause stretching of the periodontal ligament, which is actually visible as the widening of the periodontal space, expressed as widening of the periodontal space. So what is the characteristic finding the disease involving many teeth? So we have widening of the periodontal ligament involving many teeth. It's a characteristic finding involved. That is scleroderma basically. It's abnormal thickening of the periodontal ligament result, which is seen as uniform widening of the periodontal ligament involving many teeth. So what are macrophages? They are like from the near blood cells it's from the modified monocytes. They are round. They are round or oval shaped cells, and they have horseshoe or kidney shaped nucleus. They are scavenger cells. Everybody knows that. What are interstitial tissues? Interstitial tissues is present between these principal fibers. Loose connective tissue present between and around that. What? Found between and among dense bundles of principal fibers. Found between and among the dense bundles of principal fibers in periodontal ligament versus interstitial tissues. Between and among dense bundles of principal fibers.